Hello, everyone. I'm Leanne Briggs with the Pennsylvania Environmental Management Assistance Program, and I'm co-chair for the technical subcommittee, and I'm pinch hitting for Mark this afternoon. I want to thank you all for joining us. Most especially, I would like to graciously thank Jesse Walters for volunteering to present to us on the topic of exploring the environmental, economic, and social benefits of effective food waste management. Jesse's with the Colorado Department of Public Health and Environment, and she's going to provide us with some information as it relates to critical issue of food waste in the healthcare and educational institutions and the current challenges and actionable strategies for reducing food waste in these settings, and also speak a little bit about effective food waste management. Just to give you a little background on Jessie, she's an experienced small business assistant specialist at the Colorado Department of Public Health and Environment. She's been there for over a decade, or I shouldn't say there over a decade, with over a decade of experience in the environmental health and science field. Her projects are focused on food waste reduction and the permitting requirements for biochar and pyrolysis, which I'm actually very interested in learning more about pyrolysis. But to that, I'm going to turn the microphone over to Jessie. And again, thank you very much for being with us today.
All right, thank you, Leanne. And I really appreciate all of you joining today. As Leanne said, my name's Jessie, and I'm with the Colorado Small Business Assistance Program. And I'm here to talk to you today about food waste reduction in hospitals and schools. So to set the stage, I want you all to imagine a school cafeteria where hundreds of meals are prepared daily, but nearly 1/3 end up in the trash. Or a hospital where nourishing food is critical for recovery, yet tons of it are discarded every year. Across the US, hospitals and schools generate millions of tons of food waste annually. And this waste doesn't just represent lost resources or dollars, it also means missed opportunities to nourish students and patients who rely on these meals. And again, it's not just a loss of valuable resources, but it also contributes to greenhouse gas emissions when food waste ends up in landfills. So by addressing food waste, we can further enhance our sustainability efforts and hopefully create a healthier, more efficient environment for patients, students, and staff. So if you're wondering why I'm focusing on food waste as someone who works in the Small Business Assistance Program, first and foremost, it's really important to me. I've taken a number of actions in my personal life to reduce my food waste, and I'm hoping to expand that now to hospitals and schools. But we're also currently conducting outreach to hospitals and schools regarding some new building performance standards that Colorado has recently adopted and which affect large buildings, including schools and hospitals. So I figured while I have the attention of those facilities, why not discuss the importance of food waste reduction? Additionally, Colorado's Air Pollution Control Division will propose a rule in early 2025 to the Air Quality Control Commission to reduce methane pollution from solid waste landfills, so it also aligns with that goal. And then additionally, in June of this year, the Biden-Harris administration released the National Strategy for Reducing Food Loss and Waste and Recycling Organics, which outlines strategies to reduce food waste in the US by 50% by the year 2030. And one of those strategies is to increase public awareness and educate consumers and businesses about food waste. So I hope to make a small dent in that today. So I'm sure you all have heard the scary statistic that 1/3 of all food intended for human consumption is lost or wasted. And when I'm talking about food waste or wasted food, I'm referring to uneaten food and inedible parts of food that end up being anaerobically digested, composted, landfilled, incinerated, disposed of down the sewer, dumped, or simply not harvested. And that 1/3 of lost or wasted food amounts to over 1 billion tons of food and $940 billion in economic losses annually. So what do all these scary statistics mean? Well, first, they highlight the importance of addressing food waste, but they also demonstrate that reducing food waste offers an opportunity for meaningful reductions in not just the waste itself, but the greenhouse gas emissions caused by food waste. And it can play a crucial role in mitigating the impacts of climate change. So I wanted to start by exploring some of the benefits of reducing food waste. Because food waste contributes significantly to greenhouse gas emissions, by reducing food waste, we can lower methane emissions from landfills, providing an environmental benefit by helping to mitigate the impacts of climate change. Reducing food waste can also help combat food insecurity by redirecting surplus food to those in need. Programs that recover and redistribute edible food can provide meals to food insecure populations and play a vital role in supporting our communities. Reducing food waste can also lead to substantial cost savings for households, businesses, and institutions. Schools and hospitals can save money by implementing better food management practices and reducing the amount of food that they purchase and discard. And these savings can then be redirected to other essential services. And then last, reducing food waste also means making better use of the resources such as the water, energy, labor, and land that go into producing food. So by maintaining our food waste and reducing it, we can lead to a more sustainable food system and better resource management by ensuring that our resources are used efficiently and responsibly. So I'm going to delve into the US EPA Wasted Food Scale, which prioritizes actions that prevent and divert wasted food from disposal. It was updated in October 2023 from the pyramid-shaped food recovery hierarchy to this U-shaped wasted food scale. It's arranged in tiers from the most preferred actions on the top left in dark green to the least preferred in red on the top right. So preventing wasted food is the most preferred option here because by preventing wasted food, we're reducing the amount of food that must be produced. Donation and upcycling are also preferable pathways because they can displace additional food production. However, even donation and upcycling offer significantly less environmental benefits relative to source reduction because of the additional energy use required for transportation, cold storage, and processing. So source reduction options should be exhausted before other pathways are considered. The middle tier pathways include feeding animals, which redirects food waste for use as animal feed, composting, which recycles wasted food into soil amendments, and anaerobic digestion, which uses food waste to produce energy and other beneficial byproducts. These pathways, while still preferable over incineration or sending down the drain, do offer smaller benefits relative to the environmental impacts of food production. And then the least preferred pathways include sending down the drain, landfilling, and incineration. Food waste in landfills and sewers, as I mentioned, generates methane, a potent greenhouse gas, and incineration releases harmful air emissions. And the emissions from landfilling and sending food down the drain exceed the benefits of energy recovery technologies like gas capture systems at landfills and anaerobic digestion at wastewater treatment plants. So we do really want to avoid these pathways. So now that we've explored the EPA's wasted food scale and how it prioritizes food reduction strategies, I wanted to shift our focus to practical strategies for reducing food waste in hospitals. One of the most impactful ways to reduce food waste is through accurate meal planning. By using patient numbers and dietary preferences to forecast meal demand, hospitals can ensure they prepare the right amount of food. And allowing patients to pre-order their meals can also significantly reduce food waste because that way we can better match food production and meal production with actual consumption, which ensures patients get what they want, thus reducing leftovers. And this not only minimizes waste, but also ensures that patients receive meals that meet their dietary needs. Offering smaller, customizable portion sizes can significantly reduce food waste. By allowing patients to choose portion sizes that match their appetite, we can avoid the common issue of uneaten food being discarded. Designing menus based on popular and frequently consumed items can also ensure that the food prepared is more likely to be eaten. So by analyzing consumption patterns and preferences, hospitals can create menus that are appealing to patients, reducing the likelihood of food being wasted. And then proper food storage is also crucial for extending the shelf life of ingredients and prepared meals. By storing food at the correct temperatures and conditions, which is hopefully being done in these hospitals already, hospitals can prevent spoilage and waste. This does involve regular monitoring and maintenance of refrigeration and storage facilities to ensure optimal conditions. Another strategy to reduce food waste in hospitals is to train hospital staff about the importance of reducing food waste. By educating our teams, we can ensure everyone understands the impact of their actions and the benefits of minimizing waste. And then next up is donating surplus food. Establishing partnerships with local food banks can ensure that excess food reaches those in need instead of ending up in the trash. Setting up composting systems for organic waste is another great way to manage food waste. Composting not only reduces the amount of waste sent to landfills, but it also recycles nutrients and creates valuable compost that can be used in gardens and landscaping. And as of June 1st, 2025, the City and County of Denver will be enacting a mandatory organics recycling rule, so it's important to get on top of this soon. And then finally, conducting waste audits is essential. By tracking food waste levels and identifying problem areas, hospitals can implement targeted strategies to reduce waste and improve efficiency. So hospitals have large-scale operations and they do present unique challenges and opportunities for food waste reduction. But by implementing targeted strategies, we can significantly cut down on food waste and improve efficiency, and hopefully contribute to a more sustainable healthcare system that benefits the environment and patient care. As for schools, there are a few effective strategies for reducing food waste, including offer versus serve, which can significantly reduce food waste by allowing students to choose what they want to eat in a reimbursable meal, thus minimizing unwanted food. Right now, the offer versus serve programs are optional for breakfast at all grade levels, but it is required for lunch for grades 9 through 12, so this could be extended to elementary or middle schools. Marketing meals effectively by highlighting popular menu items and organizing taste tests can make meals more appealing and engaging for students and encourage them to try new foods. And also posting menus online or redistributing them in advance allows parents and students to review and discuss food options ahead of time. Extending the lunch period from 20 to 30 minutes can improve dietary intake and reduce food waste, as students have more time to finish up their meals. Additionally, moving the lunch period to after recess can work up the student's appetite and lead to them to eat more of their lunch instead of discarding it. So if they're anything like me, like students might rush through eating their meals so that they can get to recess. So having lunch after allows students to take their time eating. Creating share tables where students can place unwanted food or beverages for others to take can also further reduce food waste and promote the redistribution of unwanted food items. And then allowing students to save non-perishable food components of their meals for later can help reduce immediate waste and provide snacks for later consumption. Food rescue is obviously another option for reducing food waste in schools. However, that introduces more variables in logistical planning. So if a school does decide to go that route, it's important to consider staff cooperation, refrigerator space, and finding organizations with needs that match the school's output, as well as coordination for pickups and transportation. In my outreach, I've spoken with a few food banks and they actually don't have refrigeration units. So it is important to get in touch with the food rescue programs and make sure that they have the capability to take on this food. So because I've mentioned food donation during this presentation, I also want to discuss the importance of food safety. Implementing and adhering to stringent food safety standards is crucial to minimize the risk factors that contribute to foodborne illnesses. This includes proper handling, storage, and preparation of food to ensure that it remains safe for consumption. By maintaining high food safety standards, we are not only protecting the health of those we serve, but it also reduces the amount of food that goes to waste due to spoilage or contamination. Additionally, I want to mention the Bill Emerson Good Samaritan Food Donation Act, which is a federal law that provides protection from civil and criminal liability for individuals and organizations involved in the donation and distribution of food and grocery products to those in need, as long as certain criteria are met. And that criteria includes that the food must be donated to a nonprofit organization that will distribute it to needy individuals. The donation must be made in good faith, meaning that the donor believes that the food is safe and suitable for consumption. And the food must be apparently wholesome, meaning it meets all quality and labeling standards imposed by federal, state, and local rules. The recipients also cannot be charged for the donated food, and the donor must not act with gross negligence or intentional misconduct, so they cannot knowingly donate food that is harmful. Non-perishable and unspoiled perishable foods can be donated to local food banks, soup kitchens, pantries, and shelters. However, a lack of guidance on food safety for food donation can act as a barrier, as many potential donors have trouble determining which food safety regulations apply to the foods that they wish to donate or distribute. So I wanted to discuss some innovative apps that have helped address food loss and waste, starting with Lean Path and Wise Up on waste. These are both apps that are designed to track food waste, so users can input data on wasted food items, and the app provides insights and analytics to help identify waste patterns. Just by understanding where and why waste occurs, these apps can help users make informed decisions to minimize food waste. Too Good To Go is a mobile app that allows consumers to purchase leftover, expiring, or misshapen food at discounted prices from local eateries. So this not only helps reduce food waste at the consumer level, but it also offers a great way to enjoy delicious meals at a lower cost. So it's kind of a win-win for both the environment and your wallet. And then We Don't Waste is a fantastic example of a local resource specific to the Denver area. This organization connects volunteers with surplus food available for rescue and delivers it to nonprofits serving people experiencing food insecurity. It's a really great model, so I recommend looking for similar initiatives in your area just to ensure that that surplus food is reaching those who need it most. Refed is a national nonprofit dedicated to reducing food waste in the US. They have a really fantastic insights engine that provides comprehensive info and analysis for food surplus and waste by sector, state, and year. So they provide this data-driven approach to help stakeholders understand the scope of food waste and identify the most effective solutions to tackle this issue. And then the EPA created an excess food opportunities map, which displays the locations of nearly 950,000 potential excess food generators, including educational and healthcare institutions, along with excess food estimates for each establishment. It includes potential excess for food recipients and related infrastructure like anaerobic digesters and composting facilities. So this will be super helpful for me in my next steps for this project. And I know that there are many more apps and organizations worth mentioning, but I wanted to highlight a few that have leveraged technology and community efforts to reduce food waste. So I've already talked about strategies to reduce food waste, so I'm sure you're all wondering why haven't these been implemented. So I wanted to quickly explore some key challenges that we face in reducing food waste in hospitals and schools. Understanding these obstacles is crucial for developing effective strategies to tackle food waste. So first we have lack of awareness. Many people are not aware of the extent of food waste and its impacts. So by educating consumers, businesses, and institutions about the importance of reducing food waste, it can be challenging, but this lack of awareness often leads to unintentional waste. Next, inadequate infrastructure. Efficient food waste reduction often requires proper infrastructure for food storage, transportation, and redistribution. And unfortunately, many of these institutions lack the necessary facilities to handle surplus food effectively. And this gap in infrastructure can significantly hinder efforts. Implementing food waste reduction strategies can also involve initial costs for businesses and institutions. And these costs can certainly be a barrier, especially for smaller organizations with limited budgets. So it's important to first start with low-cost solutions and then scale up when possible. Reducing food waste requires significant changes in behavior at all levels, from individual consumers to large institutions. Encouraging people to adopt new habits and practices can be difficult, but it is a critical component of any successful food waste reduction strategy. In some cases, rules or regulations can hinder food waste reduction efforts. While there are laws like the Good Samaritan Food Donation Act that offer some protection, awareness and understanding of these types of laws can be limited. And as a side note, additional confusion over date labels like sell by, use by, best before can lead to unnecessary food waste. So standardizing these labels could help reduce food waste by making it clear when food is actually unsafe to eat. And then finally, accurate measurement of food waste is essential for developing effective reduction strategies. However, collecting and analyzing data on food waste can be complex and resource intensive. And without reliable data, it's hard to track progress and identify areas for improvement. However, some of those apps that I just mentioned can be helpful in doing that. So now that we've explored various challenges associated with reducing food waste in hospitals and schools, I wanted to shift our focus to some inspiring food waste reduction stories in hospitals and schools. And these stories demonstrate that despite the obstacles, significant progress is possible. So starting with Gunderson Health System in La Crosse, Wisconsin, who implemented a tracking program called Lean Path, which I mentioned earlier, to monitor their food waste. And by using that app, they discovered that they were generating about a half a ton of food waste weekly. So by identifying the types and times of food waste, they were able to make targeted changes and significantly reduce their food waste. Providence Health and Services, which is a hospital system in the Western United States, introduced a meals on demand system to replace fixed meal delivery times. And this change was prompted by observations that many meals were wasted when patients were out of their rooms during meal deliveries. So for instance, if a patient was at physical therapy and they had some soup delivered while they were gone, and by the time they get back, that soup is cold, that food is likely to not be eaten. So this new system not only reduced food waste, but it also improved patient satisfaction. Overlook Medical Center, which is a part of Atlantic Health System in New Jersey, has been recognized for its efforts to reduce food waste because they focused on smart purchasing and menu planning, which included using common ingredients and repurposing unused food. And these strategies have helped them cut food purchasing budgets by 6%. And then UC San Francisco Health partnered with a company called Copia to reprocess and donate their remaining food to local residents in need, diverting about 50% of their landfill waste. So that was also a pretty impressive success story. For some school success stories, in Boston Public Schools, they introduced a trayless system in their cafeterias. So this requires students to carry their meals on plates rather than trays. And this simple change led to a 32% reduction in food waste because without the trays, the students were less likely to take more food than they could eat. In LA School District, they introduced share tables where students could place unwanted, unopened food items for others to take. And this initiative resulted in a 20 to 25% reduction in cafeteria food waste and ensured that nutritious food was redistributed rather than thrown away. And then here in Boulder Valley, the Boulder Valley School District implemented a comprehensive waste sorting and composting program. They engaged students in sorting food waste and composting organic materials, and the district reduced their landfill waste by 30%. And this effort also included an educational component, which taught students about the environmental impact of waste. And then last, Minneapolis Public Schools partnered with local organizations and created a food rescue program. And they also created a food waste action plan, which aimed to reduce waste in cafeterias through operational changes and providing schools with resources to educate and engage students on waste reduction, recycling, and composting. So this was an interesting one that I came across, but milk obviously carries a large environmental footprint and is a required offering with every school meal. And I came across this interesting case that I wanted to share that explored using milk dispensers instead of individual milk cartons. Milk is typically delivered via individual carton or plastic containers, which lends itself to packaging waste. And this waste typically cannot be recycled. And using milk dispensers instead of individual milk cartons can have a number of benefits. Excuse me. Dispensers allow for better portion control. So students can take only the amount of milk that they need, which reduces the leftover milk that gets discarded. And milk dispensers eliminate the need for individual cartons, which reduces packaging waste and the environmental impact associated with producing and disposing of cartons. I believe when I was researching this, I read that milk cartons make up about 50% of a school's trash. So cutting back on milk cartons would make a huge impact on waste. Milk in dispensers is often kept in optimal temperatures, which can help maintain its freshness for a longer period compared to milk in cartons that might be left out if improperly stored. And then bulk purchasing for dispensers can be more cost effective, which can lead to better inventory management and less waste due to over-purchasing. In fact, one school in Clackamas County, Oregon, that made the switch from milk cartons to milk dispensers saw their purchasing of milk decrease by about 40% per month. So reducing food waste in these institutions can definitely seem daunting, but breaking it down into manageable steps can make the process more approachable and effective. So I wanted to explore 4 key steps to get started. Starting with data tracking. Begin by collecting data on the amount and types of food waste generated. This will help identify the main sources of food waste and track progress over time. You can use apps or tools and the tracking software I mentioned earlier to gather accurate data. And in schools, you can involve students in the process to raise awareness and educate them about the impact of food waste. Next, find champions and identify and empower individuals who are passionate about reducing food waste. These champions can be staff members, students, or volunteers who will lead and advocate for waste reduction initiatives. In hospitals, this might include dietitians or kitchen staff. And in schools, you can look for enthusiastic teachers, cafeteria staff, and students, or really anyone who's willing to lead and advocate for food waste reduction initiatives. Third, education is crucial. Educate everyone involved about the importance of food waste and the benefits of reducing it. So this includes staff, patients, students, and even their families. You can use workshops, posters, and interactive activities to spread the message. In schools, integrate food waste education into the curriculum to foster long-term behavior change. The USDA, FDA, EPA, and World Wildlife Fund have some incredible resources for integrating food waste into curriculum, and even ready to print posters and infographics to post in schools. And then finally, establish clear, achievable goals for reducing food waste. These goals should be specific, measurable, and time-bound. So for example, you can aim to reduce food waste by 20% within the first year, and then regularly review and adjust these goals based on the data collected and progress made. So as for next steps of this project, I'll be conducting outreach and completing site visits. I'm hoping to connect with key stakeholders such as hospital administrators and food services staff to gather additional insight so that I can better understand the unique challenges and opportunities at various locations and provide feedback on strategies that have or have not been implemented. And then lastly, I'm saying this to keep myself accountable, but I will be volunteering with a food rescue organization in my community. I've had this on my list for about a month now. So like I said, I'm saying this into the universe to keep myself accountable and to lead by example, and hopefully encourage some of you to get involved in local food rescue programs in your area. And with that, I'd be happy to take questions. I would also love to hear back from any of you if you are willing to share any food reduction strategies that you're aware of in your communities. And thank you so much for joining today.
Thank you, Jesse. That was very good, very enlightening. I can speak to the fact of the Too Good To Go app. I have used it with our local Whole Foods here where I live. And I'm also familiar with the Flash Food app that's with one of the local grocery stores that we have here as well.
Okay.
To that, I'm curious, is this a separate, maybe, I'm talking about funding here. Did you receive a separate grant for this program, or is this just something within the Small Business Assistance Program that you've kind of taken on as a niche?
Yeah, taking it on as a niche. Like I said, we're conducting outreach to hospitals and schools for building efficiency standards. So I figured while we have their attention, we can also talk about food waste because it's important to me. But we did not receive any extra grant or anything like that. Typically in Colorado, we spend 50% of our time on assistance requests and then about 50% on projects of interest. So as I mentioned earlier, pyrolysis will be in my next one.
Yeah, so I'm definitely interested in that one. Not that I'm not interested in this one. There are a couple questions in the chat if you can open that, or I can read them to you, whichever you prefer.
Let's see. Have any suggested food reduction solution strategies or success stories been evaluated for patient and or student health improvements? Not that I am aware of. These were just success stories that I came across in my research, but I'm not sure if they've been evaluated for patient or student health improvements. And then Kaitlin mentioned pyrolysis and plastic recycling in 2025 is my project. Here in Tennessee, we have the Get Food Smart program as part of our P2 program. Excellent. I will check that out, Doctor. Thank you. And then from Jacob, have you seen much movement on anaerobic digestion as opposed to, or aerobic digestion as opposed to anaerobic digestion? No, I have not explored that too in depth, Jacob, but I would love to look into that further. Do you have any more insight on that out of curiosity?
Yeah, so the reason I bring it up is a lot of times you think about anaerobic digestion, which does generate methane, and it's not necessarily super high up there on that food waste scale, right? Really want to do the prevention first. But a colleague and I recently were speaking with a a group, and as part of that group, one individual was representing somebody from a company that is a startup with aerobic digesters. And a lot of the stuff that they were presenting seemed kind of like too good to be true in a way. But if it is indeed true, it seems like they would be a vastly superior option to anaerobic digestion, and could be a pretty good opportunity for restaurants or hospitals and schools, if some of the options such as just preventing food waste is not quite available. So there is a company that we spoke with that I can send you the information on if you're interested.
Yeah, I would love to see that. Thanks, Jacob.
Yeah.
Any other questions?
Sydney just said in the chat, feel like using patient and or student health improvement data could be a good leveraging point for getting organizations involved. And I definitely agree, Sydney, so I will look into that. Thank you.
Are you going to share this presentation as well, Jesse? We can put it on the
Yep,
National
absolutely.
SBEAP website.
Yep.
Okay. Last call, any other questions or experience with this topic? All right, having none.
I actually wanted to ask a question just of the group in general. A trend in, I think, in Colorado and across a lot of the SBAP programs is we're always trying to find new ways to reach our audience. So if anyone has new ideas outside of, our traditional sending postcards physically in the mail, doing mass email outreach, cold calling, working with trade organizations if we can find them, any other ways that you have found really successful to reach your customer base, we're always interested in hearing those. It's completely okay if you don't have non-traditional ideas as well.